Hey Lisa, how are you today?
I'm doing great.
All right, so tell me a little bit about what kind of symptoms you were having with respect to your headaches before you met me.
I was having migraines pretty much daily. They were 7, 8 out of 10 in intensity, sometimes stronger, lasting for hours at a time. They'd wake me up at night. They'd keep me up at night. It just pretty much was my life, was the headache every morning, knowing that I would probably have a headache.
Right. And what kinds of things had you done up to that point to try and treat these headaches?
My primary care had me on some nerve medicine, and some muscle relaxers to see if that would help. I had been seeing a neurologist for about a year who had tried several different medications, including I think it was like 37 Botox injections, which did not offer very much relief.
Okay, and you'd also had a bunch of other injections and done physical therapy.
Yeah, I had done a lot of
things like that, right?
No, I had not done acupuncture.
But maybe chiropractic.
But I had done some chiropractic, and that made my head, along with an injury I have to my neck, worse.
Okay. So then we examined you and we treated you with focal Botox injections. So on the day that you came in, we basically gave you 4 injections, I think, as opposed to 37.
Yeah.
And what was your result with that?
That helped quite a bit. It relieved a lot of the intensity, the frequency. They were nowhere near for several weeks until the Botox wore off. The intensity was nowhere near what it had been before, or the frequency.
Okay. And so based upon that result, we operated on 2 nerves on the back of your head and 2 nerves on either the temples, on each side of the temples. And tell me a little bit about what your experience with surgery was like.
It was good. I love the staff down at Premier. The staff there is great. I was taken care of very well. The recovery was fine. I had, for the first probably week, maybe 2 weeks, I had a hard time getting comfortable in my bed. So I slept in the recliner to get comfortable, but it didn't take long to really see a difference in my headaches once I wasn't taking the pain medications on such a regular basis. Once I eased up on that, I really noticed that the headaches were not as severe.
Okay, and so now you're 3 months after surgery. What are things like now?
Oh, they're great now. I have a mild headache maybe every 2 to 3 weeks, lasting maybe an hour, 2 hours at the most. Most of the time I don't even need medication for it. It's just a little ache. It's not the throbbing.
And what would you say the severity is like on a scale of 1 to 10?
2 to 3,
okay,
maybe.
So a quarter of what it was before.
Yeah, and it's nowhere, the intensity's nowhere near what it was, the frequency's nowhere near what it was. I'm not having to stop activities that I'm doing because I've got a headache. I'm not, going someplace and then, I've got to go home because I've got a headache. That type of, it's not interfering in activities anymore.
Good. And what about all the other headache medicines that you were taking? Are you still taking those?
No.
So the headaches are less despite being off all of that stuff.
Exactly,
right.
Exactly.
So the last question I guess I would have is, would you ever do this again if you had to?
If I had to, if the headaches were this bad again, I would definitely do this again.
Okay.
And I would recommend it to anybody having these problems.
Well, thank you for taking the time to talk to us. Really appreciate it.